Hello everybody. A warm welcome to all our presenters and to everyone who's attending today or tonight, depending on where you are. My name is Vivian Elton. I'm Chair of the IPA and Humanitarian Organisations Committee, which includes the Migrants and Refugees Committee of the IPA and the United Nations Committee of the IPA. Our topic today is creative projects in psychoanalysis, and this is the first in a series of monthly webinars that will celebrate the work of IPA psychoanalysts in the community. Each webinar will showcase a range of different community projects and demonstrate the valuable contribution that psychoanalysis can make to society outside of the consulting room. First, I'd like to introduce you briefly to the work of our committees. One of our important aims is to foster and develop relationships and to create networks between psychoanalysts and humanitarian organisations and to support the development of projects in the humanitarian field. We aim to encourage an interchange of experiences both within and outside the IPA. In canvassing our membership, through conferences and applications for prizes, we have found many individual members and societies who are working within organisations and providing assistance to people in dire need. Many have developed creative and inspiring programs in the community. The Ububele BabyMat project and the Adolescents and Migrants project, which we will hear more about shortly, are two wonderful examples of these programs. I would like to recognise all of our members who have applied for these awards, both this time and at the last opportunity in 2018, as well as all of those members and candidates who are carrying out their work in the humanitarian field and who may not have applied for the awards. Part of the work of our committee has included seminars to share each other's work with members, candidates, and non-members of the IPA at a number of conferences. We're also engaged with our own projects working in the humanitarian field and within the structure of the United Nations. And we're also writing a book, which will be hopefully published next year. We've developed a database of some of this work, which will be published shortly on the IPA website. And I would like to encourage members working in the field to contact us. Please let us know about your work so we can enter it into the database. We are currently working on a separate website which will be called the Open Door Review of the IPA in the humanitarian field. And we would like to invite all members and candidates to contribute papers about their work, as well as thoughts about working in the field. We'll hold all of these papers on the Open Door Review website, which will facilitate not only sharing the projects, but expanding everyone's understanding of the creative possibilities of working in this area. It isn't quite ready for publication, but will be announced shortly when it's available in the President's newsletter. Now, our first speaker was going to be Virginia, but she will hopefully be joining us soon to discuss her vision of creating the community committees. And we're very excited tonight and today to be introducing two outstanding projects of psychoanalytic work in the community which are currently in operation. Catherine Frost from South Africa will present the Ububele BabyMat project, which is the winner of the President's Award. And Laura Ravioli from Italy will present her project entitled Adolescents and Migrants, the Poetry of Resistance and Play. This project is the winner of the IPA Community Committee in Education First Prize. And we're very excited about both of these projects. Now I'll tell you something about the format of the webinar today. The webinar will last for an hour and a half. We have two sections. In the first section, each of our panelists will give a 10 to 15 minute presentation. In the second section, we will have a discussion amongst the panelists, followed by a question and answer section devoted to a free exchange between everyone who's attending and the panelists. You'll find a question box on the right-hand side of the screen in the control panel, and you can type in your questions at any time from now on, but please remember that we won't be able to answer your questions until we get up to the point where we finish a discussion amongst the panelists. So, so without any further ado, let me introduce you to Catherine Frost. Catherine is an educational psychologist and director of the Ububele Education and Psychotherapy Trust, an NGO in Alexandra, Johannesburg. Catherine was the head of the Ububele Parent-Infant Program for 10 years. She developed the Ububele BabyMat project, which has parent and infant mental health as an area of specialty and focus. Catherine has trained and supervised professional and lay counsellors and authored several articles on the infant mental health interventions at Ububele. She has presented Ububele's work at local and international conferences. So welcome, Catherine, and over to you.
Thank you so very much, Vivian, and thank you to the IPA. So good day. It's early afternoon here in Johannesburg. Good day from Johannesburg, South Africa. I'm thrilled to have received this award on behalf of Ububele Educational and Psychotherapy Trust and the South African Psychoanalytic Association. Thank you so much for recognizing us. Matthew, if I could please have the first slide of the presentation. So Ububele was established in 1999 as a training and service NGO on the outskirts of Alexandra Township, Johannesburg. Ububele is a mental health organization which aims to develop and train professional and lay people in preventative mental health interventions and programs developed specifically and adapted specifically for South African communities. We have a focus on the first years of life, from pregnancy to preschool, and we draw on indigenous knowledge systems, attachment, psychodynamic, and developmental theories. Ububele was started by two psychoanalytic psychotherapists, Tony and Hilary Hamburger, and I think that they are in attendance today. They have both contributed to the start of Johannesburg's and South Africa's journey into psychoanalytic work, and with Mark Soames, Sue Levy, and others, to the establishment of the South African Psychoanalytic Association. This award recognizes Tony and Hilary's, and indeed all of us at Ububele, our work. It also represents some of our attempts to address the terrible struggles of South Africa's past and present, how the echoes of our past resonate in the present, and how our present really calls on us to address what was left unacknowledged and unprocessed in our past. If I can have the next slide, please, Matthew. Just to give you a sense of the context within which we work, in the background of the image in front of you is the Sandton precinct. Sandton is the wealthiest square mile in Africa, and then in the foreground and right adjacent Sandton is the township of Alexandra, a relic of our apartheid history and where some of the poorest South Africans live. It's a highly densely populated area, high levels of unemployment, crime, and social ills. If I can have the next slide, please, Matthew. The following are some images from within our context. You get a sense of some of the ways in which people live. And in the bottom left-hand corner, you will see one of our Ububele home visitors, who is also a BabyMat practitioner, on her way back from doing a home visit. So this is the context within which the primary healthcare clinics that I'll be describing a little bit later are. The next slide, please. Okay, the Ububele BabyMat project began in 2007 after a course facilitated by Tessa Burridon of the Anna Freud Center. The course was an introduction to parent-infant psychotherapy. We were excited and stimulated by the opportunities that parent-infant interventions offered us, and we're eager to integrate these into our basket of psychoanalytically informed services that were already on offer at Ububele for children and their families. So Tessa Baridan and I brainstormed ways of integrating the learnings from her course into our context, and I began by conducting a 6-month observation of a well baby clinic at Masekane Primary Healthcare Center in Alexandra Township. So after 6 months, we decided to place a mat on the floor. Can I have the next slide, please, Matthew? Here's an image. However, it was only after being joined by my colleague Brenda Sapuma, who's in that image, and her introduction of a multilingual introductory talk that we began to have visitors on the mat. This talk has evolved over the years, and in it, we talk about the value of relationships, the power of healthy attachments, and the capacities of infants. Within the talk, we also acknowledge the challenges of parenting and then offer a space for parents to talk, share, and think about that particular baby. And the following video that Matthew's going to hopefully stream for us will give you a live example of a typical case that may make use of this service. That, Matthew. And I know that I've just got a minute or so left. If I could just have the final slide, please, Matthew. I hope there'll be lots of responses to that video and that you'll have time to engage with it at the end of the presentations. And I look forward to that conversation. So thank you so much for the opportunity to share. I suppose this is the final slide I just did want to speak about, and hopefully we can engage a bit on it. That through this process, what we've really been able to do is to find our own language for much of the theory that has informed our work. The Umdlezane period is a period postnatally that really speaks to aspects like Beyond's Container Contained and Stern's Motherhood Constellation. And we make use of the term mhlawumbe, which means perhaps in isiZulu, as we go on a process of wondering with a mother, father, or their baby about the presenting concern that is presented to us on the mat. And all the while, really make use of the construct abazali abazamayo, which literally means the parents who keep on trying, really referring to the notion of being a good enough parent. Once again, thank you so much for the opportunity to share our work, and I look forward to engaging with you all a little later. Thank you.
Thank you so much, Catherine. That was a lovely presentation. I'd like to now introduce everyone to Sergio Nick. He's currently just taking the place of Virginia Unga, who's having some technical difficulties. So thank you very much, Sergio, for coming on to speak about the Community Committee project. Sergio, as everybody knows, is the Vice President of the IPA and a training analyst and child and adolescent psychoanalyst from Brazil. So I'd like to introduce you to Sergio. Thanks.
Happy to be here. For us, Virginia and I, this is one of the most important webinars we are doing because they match two special things. One is the IPA and the community work. The other is the fact that you are doing something that we have always dreamed of, working with children and adolescents and parent-infant intervention, which is something that we really wanted to have presented to the whole IPA community. Obviously, I'm talking in a kind of improvisation because I was just hearing the webinar when I realized Virginia weren't able to join because she has some problems with her internet. She's not in Buenos Aires now, and she apologized for that. Just to give you a very brief presentation of the IPA in the community area is a new area that we have created to try to show that the majority of the IPA psychoanalysts joining teachers, social workers, people in the law field, in the culture field, and other doctors, and so on, are working outside the couch and doing some fantastic jobs. We were very astonished when we started the area and we received many emails saying, oh, that's good, I work here, I work there, I do that, and so on and so forth. And then we decided to open what we call IPA in the Community Awards, that now the Ububele project had won the President Award, that will be given during the upcoming Vancouver, so-called Vancouver Congress, which will be also online. But the idea was to show how many people are working on that area, and at the same time, please those that are doing the jobs that not us, but the committees have chosen. The choice is not made by us, it's made by each committee area. IPA is split in several areas: law, health and mental health, culture, humanitarian organization, migration. We have several areas that we think it's important to have a psychoanalyst speaking. Why? I think that the video that Catherine had shown shows very well the importance to have a psychoanalyst in a position that others won't be able to address a question. So you firmly were capable to understand that there were mourning there that hadn't been done. And perhaps talking about that could heal that situation that the baby had. This is something that only us, not only, but we are very capable to deal with. And you will see with the video of the Adolescents that Laura Havaioli will present. So I think that we are very capable at our office with our patients directly, but we have also another way to produce psychoanalytic thinking and psychoanalytic work. This is the main reason we have opened this new area in IPA. And we were very pleased to receive 126 proposals to the awards for the London Congress. We usually, when we open an award, we receive 5, 10 proposals, just to show how many people in IPA are working on that area. I won't take too long. I just wanted to say that I regret not having Virginia here, and I'm very pleased to have you all here showing your work and presenting it to the wider community. Thank you so much.
Thank you so much, Sergio, for joining us in a last-minute event. And I hope that you'll be able to stay on and join us for our panel discussion as well. If that's possible, that would be wonderful.
Yeah, actually, just to say, not a problem, I will have my COVID test today in the morning, and we don't know at which time the nurse will arrive here. And when she arrives, I will have to go there and get my blood tested, and I will come back, okay? And I apologize for that.
Thank you so much. We're very grateful that you could join us. Okay, this is an instance of the real world coming into our webinar, isn't it, for everybody? And now I'd like to introduce everyone to Lara Ravelli. Lara is one of our IPA in the humanitarian field committee members working with the IPA in the United Nations. Lara is a psychologist and psychoanalyst of the Italian Psychoanalytic Society and is its editorial board member on social networks. She's also a member of and works with the Italian group PER, which is the European Psychoanalysts for Refugees Committee, which is quite a large group and very effective. She's a past member of the IPA Image Task Force and Public Communications Committee and sings jazz in her spare time. So I'd like to welcome Lara to talk about her wonderful project.
Thank you.
Thank you very much.
Thank you, Vivian. Thank you, Sergio. And I'm very grateful to the IPAO and for this community award and for this chance to divulgate the project. And very grateful to Cinzia Carnevali and Gabriele Lavandi that lend me the honor to present it. And this has been a real teamwork. We are all part of Italian group PER, as Vivian says, that we thanks for the support, as well as all the executive board of Italian Psychoanalytic Society, in particular Anna Nicolò and Fabio Castriota and Mary Giannini. And as I told you, it has been a real teamwork of Italian Psychoanalytic Society with other psychological society that share with us a psychodynamic approach. Società Italiana di Psicodramma Analitico and the School of Groups Psychotherapy, CORAG. And also with our association that works with migrants in the area of Rimini, where the project took place in the last 3 years. Associazione Arcobaleno, Associazione Margaret, Istituto Scienze dell'Uomo, Progetto Interazioni, and the Cooperativa CAD and Centofiori. Also, we found a great collaboration from the high school and their teachers in Rimini, especially those schools focusing on artistic work, on social science and literature. But especially all this work of integration belongs to the young students and migrants. And since the target of this project are students of high school, young refugees, and the whole community they belong to. This project had the mission of encouraging the integration between the students and the migrants among the young population to reduce the prejudice that we think strengthens social anxiety. At the third edition, the project has proposed a path of laboratories through one of the most artistic form of resistance against the disaggregation of social system. That is rap music, that from the 70s in the United States has become a spatial expression and fight against the authoritarianism. In the first year, we worked through music, jazz music, and the second year we work on theater. Last year, through these laboratories that were held by experts in rap music and coordinated by psychoanalysts, the adolescents and migrants have worked out towards the development of a subjective identity, freeing their ability to play and examining in depth the theme of diversity and multiplicity in gender, in culture, in religion, that belong to the marginalized group like migrants, but also victims of bullying and victims of indifference. And Adolescents and migrants have been involved since the very beginning with the graphic contest for the 3 evenings opening conference and show that is called Music and Psychoanalysis, where the outcomes of the project are presented to the community, along with some reflections by psychoanalysts and psychotherapists that work on the project. Actually, the sub-project Music and Psychoanalysis is at its 10th editions, and every year focus on a wide subjects of distress, such as bullying, violence on women, before being included on this larger project. Unfortunately, the other 2 evenings conferences and show due to the pandemic crisis of COVID-19 has been cancelled, but the laboratories continues online and developed in a video to share their experience with the collaboration of several well-known professional Italian rappers. There are Stefano Borserio and Tommy Cuti, Irol. And we think that both adolescents and the refugees have benefited of this to overcome isolation and to keep contacts during the strong and long lockdown that we had and we still have in Italy. And you see the poster and the show and of the pictures that Matthew is passing by the slide that the Matthew is kindly sharing with you. I think that this project built a container to welcome all the adolescents' emotions and recognize and give value to the project of subjectivation in adolescence in a multicultural and social context, and help the integration also in all the social community, and also enhancing artistic competence that we think can reach and nourish the mental and affective life of everyone. And also it has taught also to us to work in groups and to take care of the others. And we think that adolescent migrants project has been so important for the community because it expanded the scope of psychoanalysis, combining the experience of students and refugees with psychoanalytic reflection. I think that all the participants had the chance to learn the importance of listening and searching for a deeper significance for racism and violence. And also, I think it is important for psychoanalysis because it gives an image of a psychoanalyst as a person involved in social problems, also to refer to in case of difficulties. And also, we hope that this project will encourage other colleagues to continue this commitment in the social context. Before showing you the video, let me thank all the co-workers in this project. There are Sonia Saponi, Silvia Cicchetti, Stefania Fabbri, Rita Rianna Belpassi, Roberta Savioli, Roberta Secchiaroli, Claudio Roncarati, Mirella Montemurro, Lidia Mulazzani, Valentina Taddei, and also, as I tell you, Cinzia Carnevali and Gabriella Vandi. They are all psychotherapists that work intensively in each, and also each one is also an artist. They are dancer, actress, writers, poets, singers, musicians, cinephiles, and dedicate their time to their artistic passion also. I guess that they receive back energy and regenerate through their artistic love. So thank you so much again for this chance to show you the project. And I ask Matthew if he can.
Oh, thank you very much, Lara, for a lovely presentation. And I'd like to let everybody know that both of those videos that you've seen tonight are available on YouTube, and I hope that we'll have the connections that people can, so that they can view them later, because they're really wonderful and really worth looking at the whole videos. We just don't have time to show them all tonight. So now I'd like to move on, and I'm very happy that Virginia has been able to join us. I think that it's wonderful that you could come, and Sergio has spoken briefly about the community committees, which has been a very special part of your presidency, among many other things that you've done. And I think it might be good if you had an opportunity to speak a little bit more to talk about that. To introduce Virginia. Virginia, everybody knows Virginia, of course, by now, is a training analyst at the Buenos Aires Psychoanalytic Association. She specialises in child and adolescent analysis and was the former chair of the IPA's Child and Adolescent Psychoanalysis Committee and of the Committee for Integrated Training. She received the Platinum Connex Award for Psychoanalysis in 2016. So welcome, Virginia. We're very happy that you joined us.
I'm very happy that I was able to connect. I was fighting, you know, here now it's 8:45 a.m. So I'm fighting with the Wi-Fi connections, 7 a.m. Finally, I got it. I was very sad not to be able to join you, but now I'm happy, and I think that I'm feeling stimulated by the video I was able to see with adolescents that live in a very difficult situation because of the migrations, and the way they asked the presenter of the video was conveying to us to find a way to play, and I find a way to play and to find some happiness despite the situation of being, you know, maybe I think that most of them, there were forced migrations. There was not something that it was something that they were able to choose. So let me tell you, I think that Sergio conveyed and he explained why we are having you, maybe you, because I couldn't hear, even I couldn't watch and I couldn't hear anything. But let me tell you that I'm very glad and I'm very happy to be here today with you all. I think in a way celebrating what was called the title of this webinar, Creative Projects in Psychoanalysis. And these are two of the projects that were awarded. The project from Ububele BabyMat, it was presented by Catherine. Hi, Catherine. And it's this is, as you know, the project that was awarded by the President's Award, and the project that Laura, I will pronounce it Laura because in Spanish it's the same as Italian, presented a project that was awarded by the first prize in education, the IPA Committee on Education. I think that, I don't know, but Sergio might have already explained the goals of the creation of IPA in the community, which is a new structure. It's not a committee and it's not a group of committee. It's part of the structure of the IPA. So, and I'm very happy that after we leave our position, it will be kept and maybe, you know, enhanced and improved. Let me say two things that I think that it is important to know that we wanted to celebrate these projects, and these projects will be awarded and some others that won other prizes during a special ceremony, one of the things that we are also sad is that we are not going to be able to meet in person in Vancouver, but we will have during the Congress in July a special ceremony to celebrate and to give the awards. But it was important for us to be able to show the importance of IPA in the community. As we saw today, it was created before the pandemic, but during the pandemic, the project of analysts that have already had a good training, and analysts, as we call in Latin America, we don't say candidate, we say analysts in training, and also people working in the, in the area of health, culture, education. And there is a subcommittee on migrations and refugees. We created that. We also created a committee on violence. And in the committee on education, that starts, focuses on since the first moments of life. I think that today we are able to witness that IPA in the community is a project that is alive, and during the pandemic, it proved to be necessary because psychoanalysis is more needed than ever. One more thing is that I'm very proud that I think almost all of our component organizations, our members, our candidates were able to help during these terrible times. The pandemic is still hitting our world in a very, very difficult way. We are, what happened today with my Wi-Fi, it's a proof of things that it's a little thing, and I'm happy that to be here, that the way we are living, facing difficulties. And let me say, the project that Catherine showed and presented, and we are going to be able to discuss more, I think we will have time. It's a very, very important project and a way that shows in a very good way what psychoanalysts and people who think and work with a psychoanalytic point of view are able to devote some time to go out of our consulting rooms, out of our institutions, and go, this is to the community and work and also make interventions. So thank you very much. Thank you very much for you, Viv, to be here, Catherine and Laura, for presenting these amazing projects that are so not only interesting, are moving and are the real proof that what psychoanalysis can do working in the community. Thank you very much.
Thank you, Virginia.
Thank you.
I'd like to, we have now about 40 minutes, and perhaps we'll spend just a few minutes, maybe 10 minutes, speaking amongst ourselves in the panel about the work that's been presented and our thoughts, and then we'll take questions from the audience. So please send us your questions. Sergio's back.
Sergio.
Hi.
So we're just going to have a brief discussion, Sergio, amongst ourselves about the work that we've heard and our thoughts about it.
May I say something?
Yes, please.
I wanted to add that it's been very moving also for us to work in it, because also looking at Catherine Ububele project, I underline the proximity, the touch that develops with with the patient, develops with the participants at the project. Probably it's something that as a psychoanalyst we are not so used to, and all this also the emotion that go through the music are very, very moving. So it's a volunteer work, but I think that it gives you so much back, that it gives you so much energy back, that is something that I really would like that as many psychoanalysts could share, could work in it. Also, that there is something, I think that this our project that we could develop, and the recognition from the IPA is so important also for the future project and for the future development, also for the relationship with the association that needs to be recognized. But there is still so much work to do, because there are so many things we have to do. During the COVID lockdown, the number of episodes of domestic violence on women and children increased a lot. And also in Europe, we are facing the dramatic news about the Balkan routes. So I think that we need to commit to this. We need this commitment to community.
If I may, I would like to make two comment questions. First, it was my huge impression on, I think it was the first photograph Catherine had shown. I thought you were taking photographs in Brazil. We have the same kind of places here, the favelas, the slums, and we try to work there. There are groups that go to the slums and try to make work. And I think one of the main aims of this new area is to share experiences. The webinars is a form for us to share experiences between all those who are working on that area. I think it will facilitate this intercommunication, interregional communication about problems that we see everywhere. So I think it's quite important when you describe your project, which is lovely. It's something that is so touching, so good to see how are you working there in the field in a very hard and touching situation. And to Laura, regarding music, we know that music is quite important for those who were taken out from their womb or their terra madre, from their land. And I wonder what kind of local music you play with them also. I suppose it's not that easy to play their music, but I heard something about Mandinga that I know is something from Africa. So I would like to hear a little bit about that kind of experience too.
Sure.
May I respond? And I see that there are several questions on the chat that relate specifically to Ububele. Thank you so much for sharing that, Sergio. I haven't seen similar images, though I think that's exactly the point about sharing in a platform like this, about what commonalities we might have. And certainly one of the tremendous challenges that we face around parenting in Alexandra is many people leave their homes, as you said, in search of work. The proximity of Alexandra to Sandton, I think, is an incentive and a motivation for people to leave. But there's a real loss in terms of family support. And I think many families experience tremendous isolation and struggle to find this umdlezane practice I was referring to within the presentation, because there's been such a what's the dilution of traditional practices. And in a sense, I think we try and be very sensitive to these practices. Our BabyMat practitioners are lay counselors that go through an intensive infant mental health training. We teach about infant observation, the value of observing interactions, but also very much kind of drilling into mining the indigenous practices pertaining to the maternal perinatal area, so that we come in with a sensitivity to what might have been lost, a wish for capturing or finding aspects of what has been lost, and trying to support that within existing structures within Alexandra. Yeah, I think that answers one of the questions about our training. Our training is very much around infant observation and recognition of the unconscious and how the unconscious manifests itself in all aspects of our work. And a tremendous focus on our own reflection. And every area of Ububele's work is embedded and integrated with supervision. So no one clinician, and we have from early childhood development teachers to lay counselors, psychotherapists and psychoanalysts within the organization. Every person is in individual supervision and in multiple group supervision spaces, because the work is so very evocative.
I suppose so.
Catherine, I want to ask you a question about, it's a part of the big Ububele project, about the work that's done with the dolls in groups, because I saw a video of it and it was so wonderful that I wanted to ask you if you could just tell us for a few minutes a little bit about that.
Sure. So that project is called our Persona Dolls project, and it's really a project for young children, preschoolers, to talk about their feelings. And we train teachers, psychologists, psychotherapists in making use of the doll in groups to talk about any particular difficulty. So at the moment, our schools have just come back after being closed, and our dolls are being used to really talk about COVID, fears about COVID. The doll has a persona that the facilitator creates, and indirectly provides an avenue for discussing the challenges of any particular contextual issue. They can be used for big traumatic events. If there's been a loss within our school, for example, we might use the doll to talk through grief, or we might even use it very normatively to talk and prepare children for separation from preschool going into their big school. And I think the Persona Doll video that's available online is really about that. There's some anxiety about going to formal school, anxiety about learning. Yeah, so that's our Persona Doll project.
I can recommend to people to look up the video that shows that, because it is really very beautiful and very moving work, as well as all the other work that you're doing and that your organisation is doing. Now I think that we should move to the question and answer section.
I'd like to answer, Sergenik, the question about the music. This a quick answer. Yes, I think music really is an extraordinary way of integration, or integration, both in the people that play music, but also in people that listen into it. So I remember that there was a nice article about the enjoying or the enjoying or listening music by Cote and Levery. And in the project, the first year we worked on music, on the local music, because they did some laboratory about the percussion, and in this last year they tried to play with something that was new for both students and migrants, that it was rap music, but the lyrics were both Italian, English, or Madinga, as one of our participants say. And so usually there is some instruments, local instruments, that the cultural mediator introduce to accompany the music or the lyrics, especially in the first meeting, when they're working on the lyrics, they're working on the metrics of the music.
Excellent.
Thanks for asking.
Thank you.
Okay, perhaps I'll put some questions from the audience to our presenters. One of the questions was about whether fathers are able to be involved in the work of the Ububele BabyMat project.
Yeah, fathers are absolutely involved. There are a growing number of fathers that are attending the primary healthcare service and accompanying their babies at primary healthcare clinics, but it remains a challenge to involve and include fathers. And in fact, this year there's a network of non-profit organizations, the parenting network I mentioned in my bio, that are getting together to really think more strategically about how we can engage fathers more effectively. We haven't had tremendous success in engaging fathers, and also have very high levels of gender-based violence and violence against children that has been exacerbated in the last year. So it's an urgent need, and there are funders actually that are interested in supporting us. So it's definitely going to be something we're focusing on.
Thank you. A question, I think, related to Lara's work. Oh, sorry, it's just disappeared. There's a question about the topic of gender. The question is that the attendee says, seeing the video, I had the impression you worked mainly with male young refugees. Is that the case? And if so, why would that be?
Well, actually, in this project, only male young refugees participate, but some women participate to another branch of a project that was about human trafficking. There was we did an evening in which there's been presented violence on women and the problem of human trafficking, and I remember that in that case also anthropologists, and we had the participation of some video from women, but in this particular project only young male refugees participate.
Thank you. There is a question about projects in Germany. I wonder if anybody knows something about that, Virginia. Would you like to speak to that?
Yeah, I know a project, but could you read the question? Because
the question is, do you know of any projects in Germany doing some similar work
I don't know about project doing similar work as the one Laura described, but I think that the current chair of the Migrations and Refugees Subcommittee is Gertie Schlesinger, and there was a huge project with migrants and refugees. It's called the Darmstadt Project, and there is an amazing work done. I don't know if there is now a project using music, but I would like to say something regarding this, because I think that today we can witness how psychoanalysis can be, so the psychoanalytic method can be used to think and to help how to think about problems in the community. I feel that Catherine's and I know that it's not only you, there is a team that is working in the Ububele project, and it's based, and you can easily see that it's based on on observation and the importance of observation for psychoanalysis and for psychoanalysts. And it is, I don't know if you, because I wasn't able to enter the meeting, if there was a video that was projected today.
Yes.
Okay.
Yes.
So you can see there the importance of a psychoanalytic way of observing, and also thinking about what is observed and then discussing in a group. This is a Esther Big method, and I taught and I practiced and I taught for a long time. But all the attendees today can see the way this method to improve the capacity to observe is used with a very solid basis in terms of psychoanalytic point of view. And it's important because the basis of the infant observation method, when Esther B created the method, the idea since the start, it started before 1948, is to go to the places where the children live with their parents, and to be there and to observe. And I think that this is a project that it's expanding, the scope, because nowadays it is not possible to think or to include the perspective taking into account the context. So that's why what you do with a large group of mothers and babies, and of course fathers are invited, if they can come, and what you could see there is how the capacity to observe is improved, not only in the baby but in the mother, and to do this in a large group is very, very important. And the project Laura, regarding music, Donald Meltzer was one of my teachers, and that's why I practiced the infant observation method, and I later taught. But he highlighted the importance of taking into account the musical components of the language as a basis of creating the capacity to talk. There is the music. We first acquire the music of the language and then the words. So it's not because I want to put together the two projects. Sometimes when you see that somebody wants to put together, but there is a basis, because the music is the most primitive way of starting, the lulling, and it's music. So it is connected to the early periods of life. So children that are refugees are going through a very difficult times, and this way to help them is great. I have to congratulate the two of you because of the projects. it was the aim of IPA in the community structure, and we can see them, you know, happening very like.
Thank you.
Thank you.
I have another question. I think this is a question for Lara. Do you work with teachers or other supportive workers to familiarise them with psychoanalytic ideas in these contexts? And if so, how did you find they took the ideas up? How was it received?
Well, there have been all the teachers and all the schools were helped us very much, because we had the chance to work on the laboratory also in schools before the lockdown. Then we continue online, but the first it was introduced. The project was introduced in school, and they included the project in also in their evaluation, the final evaluation of the schools, and in their laboratory, artistic, or also in the school program. So it wouldn't be so easy for us to involve the young generation if teachers and school weren't so were involved in the project and in first person interest. Actually, they find out that the students, that they thought that they often had difficulties in being involved in the class working. They found out that the teachers were very surprised to find out that some of them were instead very involved in this project. So it kind of helped also people to come out and recognize in some particular capabilities, some particular play, for example, we're very good in playing music or in lyrics, and this came out during the project.
I have a question here. The presentations are profoundly moving. Music is there from the beginning, of course, in the womb onwards, which is what Virginia has just said. The combination of music, and especially music therapy and psychoanalysis, is very exciting and really does operate at a primitive grassroots level, not in the ivory towers that people often see us as practicing in. These projects are so inspiring, and especially because they are happening across the world and with a diverse group and cultures. I think that's an interesting comment. Do any of you want to respond to that?
Yeah, I suppose I want to just echo some of what Virginia is saying and make a link between the Ububele project and some of the infant mental health techniques and theory. We very much focus on infant observation, but also the work of Colwyn Trevathan and about communicative musicality. And we make use of observe videos in all of our trainings for our lay practitioners and our professionals in the infant mental health interventions that we offer. We very much observe this really right from the beginning. And there was a question about some of the theory underpinning infant mental health work. Yeah, and we very much make use of I suppose Bion's notion of container contained, and trying to find that kind of function in the brief time that we sit on a mat in our context.
Yes.
May I a question to Catherine. Now that I'm hearing this, to use the mat, I would like if you have I could explain, because it has to do with the idea of it's not, the container is not a concrete thing from my point of view, because I follow Beyond's idea that it's a mental function. But how did it start, the idea of the Ububele BabyMat project?
It really started after doing the traditional training with Tessa Baradin on parent-infant psychotherapy, and she felt it was important, before we integrate that model into our programs, that we needed to spend some time observing babies and their parents at the primary healthcare clinics. So actually it started off with a 6-month observation of a primary healthcare clinic, and my sense of the communality of the clinic and how much time people are waiting, their long queues, that in a sense we've got a captive audience, and that if we could carve out a space, as you say, it's a literal space, but a space in our minds and in their minds to find something thoughtful when there's a lot of time. So we just took a chance, and I had to sit by myself for a while until I had a kind of cultural bridge through my colleague Brenda, who linguistically, and I think from coming from that community, was able to bridge something for Ububele, myself, and the moms, dads, and babies that were waiting. And we just tried it and brought it back to the team, and it's evolved over time, and I think our observational skills have improved as we've focused more on that.
One of the questions was, I'd like to ask the panelists how their work in the community has enriched their identities as psychoanalysts and their work in the consulting room.
Absolutely. Well, as I told you, our team of psychoanalysts and psychotherapists had in common the fact that we love arts, and we spend some of our free time in some of our passion that are music or our theater or also cinema or poets. And I think that this is also is a very important way to enrich our identity as a psychoanalyst. I can remember that Anna Freud, in a letter related to do you remember, to a young, I think a young student or son of one of her friends, asked her what to do to become a psychoanalyst, and she suggested also to read a lot and to do some creative works also. And I think that this helped us a lot also, also to go deep on some themes. For example, they said before, they asked before about the topic of the gender, and some of the topic of the theme of the lyrics of the music were about the travel, were about the identity, were about femininity and masculinity, and all of this. I think it can be, you can work on it through music, but also through arts, through movies.
If I can respond as well, I've been working at Ububele for 16 years. South Africa remains a deeply segregated, divided society, not just racially, but economically, like I'm sure panelists here would share. And the privilege of working at Ububele has really been opportunities to bridge those divides. I can't tell you how much I've learned
Thanks. Another question for the panel is how do you keep the projects functioning during the pandemic? A big question.
Well, I'll let Catherine answer, because for us it's been easier because we could continue the work, the laboratories online and develop the video that then develop also in a song. But I'm also very curious about how Catherine and the project could develop during the pandemic.
Well, during the pandemic, obviously, to put a mat down at a clinic has been a real challenge. So we've had to focus our work much more on the nursing staff to be able to identify at-risk mums, dads, and babies. And we've actually had a very exciting funder who's come on board to help us develop online communication tools via WhatsApp. And so we've reached out towards nurses who are then facilitating, identifying worrying dyads, and we are running WhatsApp messaging. Of course, there's a tremendous amount that we lose because we can't observe babies, and data is inaccessible for most of the families within Alexandra. But this, you know, it's actually got a name. It's called the Vuna intervention. Vuna means harvest in isiZulu, harvest, and it's very much this notion of harvesting and fertility. So we've gone online. Our COVID numbers have come way down. So we're back in the clinics again. We've really just we are essential service workers, are due shortly to be vaccinated, and as soon as it's deemed safe by our Department of Health, we've gone back to clinics. So we're back. Yeah.
It's wonderful to hear how you've both been able to keep it all going over such a difficult time. Sergio, I think you had something you wanted to say.
No, just to say that my experience, like many other psychoanalysts working on the community, is really well enhanced by the very different experiences we have on community work. You are there, you don't have the whole setting mechanism that you have on your office. So you are much more exposed, my point of view. I agree with Catherine, we have to use our inner setting, which is harder in some situation. And this, I think, is one of the main achievements we have when we work on the communities. We start to see some kind of anxieties crude in the very savage state, and we have to deal with this. It's not easy. You see during the video how Catherine is looking at Happy and the baby and trying to understand the situation in a very quick interview. It was not something that relaxed as we do during our consulting rooms. I think it's amazing, the difference.
Thank you. We're almost out of time. Virginia, you wanted to say?
Yes,
something.
I only wanted to say that taking into account your questions or somebody's question about the COVID, I think that it is still a challenge and a proof to all of us, and we are learning how to use different, and we use what we can. And that's what it's moving regarding your project, Laura, and your group, because adolescents know more about technology than the one, so they can teach us. So this is a revolution we are experiencing. It's not older people, the elders that are teaching youngest, they teach us. And the other thing is that going back to the Ububele project, that you used what you had. So you used WhatsApp or what you had to keep this containing function, and this is what we have done all over the world with our patients, with our seminars, with our conference, and with our congresses. So, and a little piece of advertising that we hope that we will meet together again in our congress in July. And thank you very much, because it was something that we dreamt with Sergio more than 3 years ago. It became a reality, and I think that an important part of the...
Hello? I think Virginia's frozen. But
Yes.
yes, we're just about out of time. So I'd like to thank all the panelists, Laura, Catherine, Virginia, Sergio. Thank you so much for your wonderful presentations and contributions today, and everybody who has attended the webinar. And I'd like to remind everybody, as Virginia just did, of the fascinating congress that's coming up, which is going to be the infantile, its multiple dimensions, to remind you that registrations are opening very soon in March. And this is going to be a really wonderful and truly international conference. There's going to be online meetings and on-demand viewings, so that we will be able to watch at all of our different times many different presentations. I think it's a very exciting development. And I'd also like to remind you that there is a webinar on the 26th, which will be in Spanish, and I don't have it in front of me, so I can't say exactly who it is. But yes, there it is. Thank you, Julio Moreno and Rafael Paz. We don't have the title yet, but the webinar will be from 4 o'clock till 5:30 Greenwich Mean Time. So maybe everybody put it in your diary and look forward to that. And so thank you again, everybody, and I look forward to the next webinar and the conference. Bye-bye.
Thank you so much. Thank you so much.
Thank you, everybody.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye, everyone.